All right. So as we get started, everyone is getting connected this morning. Again, we just want to thank you all for joining Great Lakes Rural Opioid Technical Assistance Regional Center's event today. We are going to be talking about how to be a recovery ally. Today's event is being hosted by the University of Wisconsin-Madison. My name is Amanda Kura. I am the project manager for the Technical Regional Center, and we're happy to have you with us today. Very shortly here, I'll be introducing our presenter, Michelle McDonald, and she will be covering our session today. Before we do that, just a few housekeeping items. I want to talk a little bit about the Regional Center and our funding acknowledgement. The Great Lakes ROTA-RC is funded by the Substance Abuse and Mental Health Services Administration, otherwise known as SAMHSA. And the funding is to provide training and technical assistance, or TA, to the rural communities of Health and Human Services Region 5, which covers Illinois, Indiana, Michigan, Minnesota, Ohio, and Wisconsin. Collaboratively, we develop and strengthen community capacity to prevent, treat, support recovery for opioid use disorder and other mental health and substance use disorders. We use a whole family, whole community approach to provide culturally appropriate educational opportunities. And through the use of cooperative education and extension state programs, we employ evidence-based emerging practices to provide virtual and or on-demand education for rural communities regarding mental health and substance use disorders in the workplace, substance use education, and other relevant topics in mental health and substance use disorders. We do this in communities with Indigenous populations, and the project operates with culturally responsive and holistic health education and resources in mind. We invite you to learn more about the Great Lakes Rural ROTA-RC Technical Assistance Center, its resources and partners by visiting the website you see on the screen, and we'll place that in the chat for you as well. So we want you to be able to access these resources as you need. Pop that in the chat real quick. So please check out the website at your convenience. We also want to just take a minute, talk about the tone of that we take in terms of the regional center when we connect with our communities, and the tone of the conversation that we'll be taking today, and we gently encourage you to do the same. So we just want to take a moment to promote the use of affirming person-first language when discussing behavioral health disorders. As we create an environment of learning together, we want to feel welcoming and safe for everyone. And so let us work together to manage a space that supports non-stigmatizing, recovery-oriented language that can help reduce negative bias and promote engagement. As we learn about successful prevention, treatment, and recovery, we welcome you formally into the Great Lakes ROTA-RC community of learning. And with that, I hand over today's presentation to our presenter, Michelle McDonald.
Hello, thank you so much for having me. I do appreciate it. As Amanda expressed, I am Michelle McDowell. I am the Senior Program Coordinator at the University of Missouri Extension's Community Health Engagement and Outreach Program. As part of my role, I get to help support the Recovery Friendly Workplace program and have developed this Recovery Ally training, which was created in collaboration with Recovery Friendly Workplace Missouri and Partners in Prevention. Much of this training was adopted from other Recovery Ally training programs from Penn State University, Virginia Commonwealth University, and the Ohio State University. The training is about how to be an ally to people in recovery. Today, we will discuss substance use disorders and recovery, address myths and stigma associated with substance use disorders, discuss recovery-friendly language, and review strategies to support someone seeking or already in recovery. Please feel comfortable coming off mute and turning your camera on and engaging in the conversation. Talking about substance use disorders can be triggering or emotionally taxing for some individuals, and we want to recognize that. So I want to encourage you to take care of yourself. If you need to step away for a moment, turn your camera off, regroup, and then come back, that is absolutely okay. I also want to let you know that if you or someone you know feels as though they are in a mental health crisis, you can call 988 for mental health support 24 hours a day, 7 days a week to speak with a trained provider. So let's start with a little background. According to the National Safety Council, while 75% of employers have had an issue with opioids in the workplace, more than 75% of adults with a substance use disorder are in the workplace. 1 in 4 Americans have been directly impacted by the opioid crisis. Either they know someone who has an opioid use disorder, know someone who has died from an overdose, or they themselves have an opioid use disorder. Additionally, more than 10% of Americans with substance use disorder are in recovery. And we'll talk more about recovery soon and what that means. According to the National Survey on Drug Use and Health, 19.7 million people over the age of 12 battled a substance use disorder in 2017. And 14.1 million adults suffer from alcohol use disorder in 2019. Unfortunately, 80% of those adults will not seek the help they need, in part due to stigma. Employers have expressed that they feel substances are becoming a threat to the state's workforce. In the image to the right here, employers ranked which substances they felt were impacting their workforce the most, suggesting that prescription pain meds were the top concern when looking at a mean ranking. All that being said, I want you to know that substance use disorders are treatable and recovery is attainable. And again, we'll discuss what recovery is and what that means later in the presentation. Furthermore, in 2012, about 10% of American adults said they were in recovery from an alcohol or substance use issue. It is important to know that there are individuals who are struggling with substance use, as well as those who are in recovery from substance use disorders. Okay, so let's start diving down, discussing what is substance use disorders. So what do you know about substance use disorders? Please feel comfortable coming off mute or entering into chat. Okay, as you're pulling your thoughts together, I'll go ahead and offer the definition, right? A substance use disorder is a disorder that impacts a person's brain, body, and behavior. With the SUD, symptoms are present indicating that an individual will continue using a substance despite significant problems. An important characteristic of a substance use disorder is an underlying change in brain circuits, particularly in individuals with severe disorders. Substance use disorders are considered brain disorders and are a chronic health condition. It's important to note that the word addiction is not used as a diagnostic term in the classification of substance use disorder. Excuse me. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, describes the following symptoms. Substance use disorders can be mild, meaning the individual has 2 to 3 symptoms present, moderate, with 4 to 5 symptoms present, or severe, where they have 6 or more symptoms. Substance use disorders might look different person to person, and these are all common. right? There's a variety of mixing that some people might present different pieces or different symptoms for a substance use disorder. If you notice any of these signs in a friend, a family member, a colleague, or a loved one, we can talk later about having a conversation with someone that you're concerned about. Okay, I'm going to ask that you come off mute again and or enter into chat. But why do people use substances? Not even if they have a substance use disorder, just in general. Why do people use alcohol or other drugs? Like, what's the motivation for use? Socializing, social, mental health reasons, yeah, alleviating pain, to change the way they're feeling. It could be used to help cope with something, relax, coping, social escape. Yeah, numb feelings. Right. These are all pieces that are reasons that people use substances to alleviate pain, feel good, right? And I think we can work all of those into one of 5 categories that I would like you to kind of consider and see where these might fit in. The first one is curiosity. Research suggests that people use substances for curiosity. So wanting to try something new, want to see how it feels, to perform better, think like academically or athletically, depending on the substance, there may be a belief that it helps you do something better. To feel better, such as like coping, wanting to not feel the typical emotion or sensations that they are experiencing. To fit in, so pressure from others or simply wanting to be doing what everyone else is doing. And finally, to feel good, such as like celebrating or socializing, right? Wanting to feel that euphoric effects that most substances produce. These choices are often made based on the environment or trauma experienced or a person's genetics. So some people are predisposed to developing substance use disorders. Risk and protective factors are not a one-to-one, and just having a risk factor does not mean someone will develop a substance use disorder. And likewise, someone could have all the protective factors and none of the risk and still develop a substance use disorder. But these might help predict or protect against developing substance use disorders. Most people who use substances do not develop a substance use disorder, but certain risk factors increase the likelihood that someone will develop a substance use disorder. A risk factor is a characteristic at the biological, psychological, family, community, or cultural level that precedes and is associated with a higher likelihood of problem outcomes. Risk factors for substance use disorders can include genetics, the environment, experiences of trauma, and the drug itself. Unfortunately, many risk factors are related and occur together. There are also protective factors that exist to reduce the likelihood that someone will develop a substance use disorder. These can also be at the biological, psychological, family, community, and cultural level. All right, so this image here demonstrates the interconnection between risks associated with developing a substance use disorder. We can use this information to identify strategies that will reduce risk factors and increase protective factors so to influence the likelihood. It's important to note that while most people use substances do not develop a substance use disorder, more than 60% of people who are prescribed opioid painkillers have at least one factor for developing an opioid use disorder. Adverse childhood experiences are some of the trauma or negative experiences that people may experience when they are young that can be major risk factors. We actually have another grant called Show Me ACEs, where we are looking at adverse childhood experiences and offering education around those to various populations in Missouri. Biology, genes, and predisposition are also risk factors. And the drug itself, age at first use, etc., can also play a role in likelihood of developing a substance use disorder. So when we talk about age of first use. The earlier in life a person uses a substance, the increased risk they have developing a dependency on that substance. So I'm just kind of curious, who can tell me what age is the brain fully developed? 3, 25, 25. Yeah, 25 is correct. Research suggests that the brain is developing until the age of 25. And what part of the brain is the last to develop? The frontal lobe. Yep, that prefrontal cortex. Yeah. Yep. Yeah. So kind of looking at the reasoning, the decision making. As adults and young adults begin using substances before the age of 25, their brain interprets the effects as normalcy. So we see signs of decreased impulse control, increased risk taking, that kind of thing. Research even suggests that among those starting drinking alcohol at age 11 or 12, 7.2% went on to develop an alcohol use disorder, as compared to 3.7% of those who waited until the age of 21. Like I mentioned before, there are things that can decrease likelihood of developing substance use disorders, and these are called protective factors. And genetics and the environment can also be protective factors, such as like if no family members have a history of SUD or they come from a stable home environment. Other protective factors would include low expectations of alcohol or drug use, parental monitoring and involvement, perceived peer disapproval of use, involvement in service-based activities, religiosity, spirituality, positive relationships that foster positive connections and support, particularly in workplace settings where support promotes recovery, as well as healthy communities where substance use is not the norm, will help members see other ways of living, stable employment and income, safe housing and healthy environments, and finally, transportation. Okay, the next few slides walk through some common statements about substance use disorders. We will start with the statement on the slide, and you can put in chat if you think it's a myth or a fact, right? So you can say true, false, myth, fact, whatever makes the most sense for you is fine. We will discuss whether it's true or false or myth, fact before showing the answer, and discuss the correct answer and why people might have misperceptions. Okay, so let's start with the first one. Interesting. There we go. Addiction is a voluntary behavior, and people just don't feel like quitting or don't have the willpower. Yeah, it looks like we see a lot of false or myths. Yep, and that's correct. The initial decision to use a substance may be voluntary, but individuals do not choose to have a substance use disorder. Using substances changes brain chemistry, and individuals develop tolerance, needing to use more of a substance to feel those same effects, and dependence. So using a substance just to feel normal or regular or stable. Okay, let's try another one. So that's a myth. And addiction is a character flaw. Yes. So it looks like we have a lot of myths in here. Yep. And that's correct. Substance use disorders are brain disorders rather than a character flaw. So substance use changes brain functioning, and this can impact all aspects of an individual's behavior, including prioritizing substance use over anything else. Yeah. Addiction typically affects certain types of people. False, myth, yep. Substance use disorders do not discriminate and can affect anyone regardless of age, socioeconomic status, gender, race, ethnicity. Absolutely. Okay, so our next one, this one kind of gave it away for you. Addiction typically, sorry. This one. Okay. Individuals can seek treatment at any time, whether their substance use disorder is mild, moderate, or severe. True, 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 true. Yes, I love seeing that. Yep, you are right. Individuals can seek treatment at any time. The longer a person waits to get help, the sicker they're going to get, right? Just like any other disease or chronic illness. And the sooner someone gets help, the better. Okay, if someone relapses, they are a lost cause. Myth, myth, false, myth. Yep. Yes, returning to use is a reoccurrence of symptoms for substance use disorders. So substance use disorders require lifelong management, and getting well is a process that involves changing deeply embedded behaviors. This takes time and effort, and there may be setbacks. If someone, I apologize, employees in recovery are more unpredictable than their counterparts. False, myth, yep. False, false. Yeah, lots of false myths in here, and you are correct. So employees who are in recovery have equal or lower healthcare costs, absenteeism, and job turnover compared to employees who never report an SUD. And employer-initiated treatment is more effective than treatment initiated by friends and family. True, true, false, true, false. Yeah, it sounds like there's a little bit of disagreements here, like an uncertainty almost. Yeah, so this is actually true. Research suggests that employer-initiated treatment is more effective than that initiated by friends and family. You might consider it as like a, sometimes it's hard to hear something from those who we care about and love the most. And so hearing it from somebody who's kind of more on the outskirts, you know, on the outside, it can be very impactful. All right, so this was a lot of information to unpack. What are your thoughts or questions do you have? Again, feel free to come off mute or put it into chat. Okay, well, if you develop any questions, you can put those in chat or send them to us later, and I'd be happy to talk more about it. Okay, so many of the misperceptions we talked through in that myth or fact section create stigma about people with substance use disorders. Stigma is harmful and perpetuates those myths and can lead to stereotypes, prejudice, and discrimination. We need to unlearn these beliefs and confront the myths that can lead to stigma. Stigma is complex, and external stigma may create self-stigma among individuals and families with substance use disorders. Stigma can lead to stereotypes, which live in the mind as thoughts about a certain group of people. Prejudice live in the heart as feelings about a certain group of people. And discrimination lives in the hands as actions and behaviors towards a certain group of people. Okay, and then I'd like to take a few minutes to share this video with you. It's only a couple minutes long. It dives deeper into the conversation of addressing stigma. Everybody hear that okay?
Stigma is the perception that a certain attribute, like addiction, makes a person unacceptable. And stigma can prevent people from seeking help due to the fear of rejection and discrimination. Stigmatizing labels we use can make
I didn't realize that muting myself would
those needing help feel less than. So what can we do? Well, we we can change our language. When we refer to those who have an addiction, we should always use person-first language, emphasizing the person before the disorder.
We at Addiction Policy Forum, we really focus on making sure that we use language that is non-stigmatizing. We use the term substance use disorder. When you say the word substance abuse, which is sort of an outdated term, when you think of abuse, you think of domestic abuse, you think of child abuse, you think of elder or animal abuse. That is sort of a criminal justice term, right? When in actuality, substance use disorder is a health condition. It's a health condition that's in the DSM-5, that has its own medical subspecialty in the medical field. And so we want to make sure that we're using proper terms that house this correctly within that health sphere that it belongs. We also use person-first language. When I talk about my parents or someone in recovery or someone with an active use disorder, I talk about an individual with a substance use disorder. We don't define or limit someone to their illness. We identify them as a person or an individual that is struggling with this health condition, but it does not identify who they are. So avoiding terms like addict, junkie, druggie, whatever it might be. Those are very stigmatizing terms. They may be terms that individuals in recovery may self-identify with, but it's important for us as leaders, family members, friends, and community members that we don't use those terms. We use in recovery, my laundry is clean and dirty, not people. And so I think being really careful about some of these terms that can be weighted and weighted down with judgment is really important. Similarly, recurrence of use is sort of how we're trying to move the field instead of relapse, which sort of feels very loaded itself. And then a positive or a negative drug test instead of dirty or clean drug test. And then an individual is currently using substances. Again, remember that laundry reminder that we don't talk about folks like their laundry.
Research has shown that the words we use when speaking to or about people struggling with substance use disorders can have a tremendous impact on their health outcomes. To learn more, visit addictionpolicy.org, and remember, language matters.
Okay. There we go. As discussed in the video, language is powerful, especially when talking about addictions, because stigmatizing language is there a link for that video? I can share it. I'm glad that was helpful. Absolutely. Yeah. So stigmatizing language perpetuates negative perceptions, and it's recommended to use person-first language that focuses on the person, not the disorder, when discussing addictions. Other ways to fight stigma are to elevate and celebrate the many pathways to recovery, share diverse stories of recovery, and highlight the recovery, not the addiction. Now, let's talk about recovery a little bit deeper. What do you know about recovery? Again, feel free to come off mute or enter into chat.
Recovery is an ongoing journey, the lifelong journey. When you are in recovery. Yeah.
I love that you use the word journey. It is a journey.
And recovery is what you make of it as well too. Your recovery is yours. It's so personal. Everybody's recovery is different.
That is exactly right. It is how you define it.
Got some contributions in the chat as well. So it's a process. It's not linear. There are ups and downs. Even when it might be presented as linear, it's not. There's no one size fits all in terms of recovery program.
Yes, absolutely. All of those. Yes, recovery is not linear. There are ups and downs. And there is no one size fits all. And that I like the phrase, it's a process. It is. Yeah. So all three of these are some definitions here, but as you can see, there are many, many more definitions that people may use when defining or describing their own recovery. And overall, many recovery formats emphasize three main pillars of growth, service, and community. And will sometimes use those in their definition of recovery. So recovery, as we just described and identified, right, it looks different for different people. There are many pathways to recovery, and people will choose the path that they take based on their cultural values, their socioeconomic status, their psychological and behavioral needs, and the nature of their substance use disorder. Some may have assisted recovery, so think like formal treatment, outpatient, rehab, using medications, and certain types of medications can assist with withdrawal or cravings for certain substances. Some might use recovery support services, so think like faith-based or recovery community centers. And some might use self-help groups like AA or so like Alcoholics Anonymous or Narcotics Anonymous. And I do want to make a note about medication-assisted recovery that I always want to express, and that is that medication-assisted recovery combines behavioral therapy and medications to treat substance use disorders. It's often called MAR, and it is most common for people with opioid use disorders, and can also be called like medications for opioid use disorder, but can also be utilized with alcohol use disorders. It's important to recognize that historically, MAR has had stigma attached to it and has been seen as like not true recovery. But to reiterate, there are many, many pathways and forms of recovery, and substance use disorders are complex. A medication-assisted recovery is a recommended recovery format by the Substance Use and Mental Health Services Administration and the American Society of Addiction Medicine. And I do also want to note that the Substance Abuse and Mental Health Services Administration has recently changed its name to substance use. And this was a decision made to reduce that stigma. And then it looks like we have a comment in chat, right? It looks like that substance use disorders is kind of like an injury, like PTSD or a result of something toxic substance. And sounds like kind of in that reflection of like that it does change the way the brain is working. So that might be something in the consideration of how definitions of recovery are different for different people in different situations. Okay, so looking at anonymity or remaining anonymous, it can be important for many individuals in recovery. The purpose of anonymity is to protect members of the recovery community and ensure that all individuals are of equal value. It also allows for a safe space during meetings and increases the feeling of confidentiality, stressing that things shared during meetings will not be shared outside of that space. And know that if someone discloses to you that they are in recovery, recognize that they may not have told others. However, some people are very open about their recovery and might feel comfortable discussing it freely. You might think of Matthew Perry's recent book where he discusses his choice of sharing his experiences widely. That was a choice that he made after decades of struggling. Others may not have made that choice, and that's okay. Use your best judgment. And if you are unsure, you can just ask the person. Returning to use, sometimes called relapse, is a part of the recovery process. It should not be viewed as shameful or like a failure. And while not everyone will return to use at some point in their recovery, it can happen. I am also a tobacco treatment specialist, so That means that I am trained to help people quit or cease using tobacco products, right? And I often tell my tobacco cessation clients to not phrase it as a relapse, but consider it as a lapse, because a lapse in time happens occasionally, but a relapse implies longer term continuation. Returning to use often indicates that treatment needs to be adjusted and certain stressors should be avoided that can trigger use. Unfortunately, there are many common triggers, so be mindful of some of these listed, such as people, so former peers, friends that an individual used with, or being around people who are using substances. Environments can be a trigger, so like thinking about bars, clubs, or former places of use. Things can be a trigger, so looking at like paraphernalia or substance use in movies or TV. And finally, situations can be a trigger. So think like stressful events or holidays or parties. Okay, what about recovery in the workplace? There was a TED Talk where the speaker suggested the opposite of addiction is connection. What might that mean for employees? According to the Substance Use and Mental Health Services Administration, the 4 pillars that promote recovery are health, home, purpose, and community. So my question to you is, how might you be a recovery ally? When you're thinking about this context, right? How might you be a recovery ally in the workplace?
Be just a safe person for the person to talk to and share with, and keep it just between you and them.
Yeah, absolutely. Be a safe person. Don't spread things, make sure that it can be confidential. Sure. I'll move to the next slide, and I'll talk a little bit more about different ideas. And we'll continue touching on this topic of strategies that you can utilize to be a recovery ally. So you can start with talking openly about the opioid crisis and substance use disorders. And remember to emphasize that recovery is possible and likely, and always provide a message of hope. Pay attention to your language. Using stigmatizing language decreases the likelihood that an employee will seek help when needed. Be supportive of others. Providing support can help change someone's life. So be in that safe space, right? Offer a supportive work environment to promote and help sustain recovery. Know the facts. Understanding substance use disorders reduces stigma and increases acceptance of substance use disorders as a medical condition from which one can recover. Excuse me. Celebrate recovery as a strength. Prevent malicious gossip. Despite best efforts, gossip can ensue. When an employee has to leave employment for substance use related reasons, try to prevent gossip and ensure an exit with dignity if that's necessary. Additionally, additionally provide a variety of non-alcoholic options at work events or social gatherings, and encourage healthy after-hour activities. And remember, your coworker in recovery could be learning how to maintain abstinence. They could be restructuring their daily lives to avoid behaviors and triggers that may lead to use. They may be balancing the demands of recovery and work. And they might be trying to make new connections and finding a new sense of belonging. Additionally, remember too that not all coworkers use alcohol or other drugs. Some are in recovery and some abstain for other reasons. Do not normalize substance use or make it seem like something that everyone is doing. As well as don't pry. If someone is abstaining from use, don't pressure them to tell you why or disclose that they are in recovery. Substance use and recovery is not a joking matter. Many individuals are impacted by substance use, whether their own or someone else's, such as like family, friend, or coworker. Be mindful and respectful and don't make light of substance use. And finally, I would encourage you to put yourself in their shoes. If you are not in recovery, think about the things you might take for granted, such as feeling comfortable when people suggest going out for drinks. Take steps to ensure that if someone is in recovery, whether you're aware of it or not, the things you say and do reflect your own understanding of substance use disorders and recovery. And thank you for sharing, Tiffany. Tiffany mentioned in chat that she herself is in recovery, or they themselves are in recovery, and work in the medication-assisted treatment program, and is very open about recovery with people who they work with, and coworkers and clients. And I appreciate you mentioning that and disclosing that. Thank you so much for sharing. Okay, and if you notice someone who is struggling with substance use, there are many ways to help. Having a conversation about a person's substance use can be really difficult sometimes, but might be the first step to them getting help. And then I have another video here that I would love to share with you. I'll go ahead and hit play.
The trans-theoretical model, also known as the stages of change, represents a person's readiness to change. There's 6 stages. These are pre-contemplation, contemplation, preparation, action, maintenance, and relapse and lapse. Today, we'll look at the model in the context of alcohol and other drug use. Identifying where a person might be at in the change process can provide some direction as to how they can best be supported. Let's take a closer look. Pre-contemplation. People in this stage aren't worried about their use. They're not interested in stopping or cutting back. Even though other people might be concerned about their use, for them, the benefits far outweigh the consequences. Contemplation. People in this stage of change still enjoy using. However, maybe they're starting to notice some problems from their use. They're weighing up what changing might mean for them. Preparation. This is when the not so good things about using are starting to outweigh the things they enjoy about it, and they begin preparing to make a change to their use. Action. They've started to make changes to their alcohol or drug use. It will depend on the person's goal, but this might include things like using less or stopping. Maintenance. They're maintaining this change. They've been in the action stage for long enough that change has become easy. They've got this. They're no longer dealing with constant cravings and triggers and have maintained their goal for a significant period. Relapse or lapse. A relapse is a return back to using, and a lapse is a slip-up. A lapse does not automatically lead to a relapse. Both lapses and relapses provide an opportunity for the person to learn more about themselves, what triggers them or challenges them, and what promotes opportunities for growth. It's really important to help the person see any lapse or relapse as a learning opportunity as opposed to a failure. People learn a lot more from their setbacks than from their successes. And that's the stages of change, or as it's known as in technical terms, the trans-theoretical model.
Okay, recognize that individuals could be anywhere along the continuum, and having an effective conversation might depend on where they are at on this continuum. To have an effective conversation, meet the person where they are at in the stages of change. It looks like my graph or my words didn't stay. I apologize. Please make sure to be an active listener, meaning listening to understand, not to respond. And remember to have body language that signals openness and that indicates you are listening, and be mindful not to play on your cell phone or use other devices or distractions. there's an acronym called ORS that we often recommend for guiding conversations. Who in this group is familiar with ORS? I see a few indicators. Yeah. So ORS stands for open-ended questions, affirmations. Nope. Okay. Yeah. So there's then reflections and finally summarization. So this is a strategy that really kind of maps out the conversation. So an example of like an open-ended question would be, how has your relationship changed with substances in the last few years? And that'll help start stimulating their perspectives, right? Just kind of start thinking critically about their substance use. It's not a yes or a no or an easy answer, right? Then you can provide affirmations by identifying individual strengths, making them feel comfortable and connected. So it's saying something like, it takes a lot of courage to talk about this. I'm honored that you chose to share this with me. Then you can use a reflection. So repeating what you heard them say. This shows that you are actively listening and understand what the person is saying. It also offers the person an opportunity to correct or rephrase if what they said was not heard or understood. So you might say something like, I heard you say that your substance use has changed quite a bit in the last year, and you have been feeling the need to use more often. You're worried it might be impacting your work and family life. Is that right? And finally, you can summarize the conversation. So this is a form of reflection that recaps what the person shared. This allows for a shift in conversation to talk about next steps. So you can say something like, I appreciate your trust in telling me about your struggle with substances. If I understand correctly, your concerns about the substance use have increased and you're experiencing some negative consequences as a result. With that, you can then offer support and move towards next steps, such as saying something like, have you thought about what you might do next? Or if it's okay, I'd like to share some resources I know of. In these conversations, avoid being judgmental, be mindful of nonverbal cues, and do not make assumptions unless the person tells you something directly. Let me see if this one will stay on better. Okay, and then not all conversations will follow this exact format, and individuals may not yet be in a stage of change where they recognize that there are concerns about their substance use. So regardless, it is critical to let them know that you care about them and that you are there to support them. Another way to approach this conversation is using these 3 simple tools to focus on behavior, express care and concern, and listen and support. So an example of doing this might be, hey, I've noticed that you are missing more work and seem distracted. I care about you and I want to make sure that you're doing okay. I'm here to listen and I know of resources that can help if you're interested. Again, make sure to be an active listener and support whatever decision they make. If they are not ready to make a change, that's okay. But you have opened a line of communication by showing that you care. Right, the next portion of the training, we'll talk about how to be a good ally to someone in recovery. Okay, so there are many ways to support individuals who are in recovery in the workplace. This training has already discussed a few main ways using person-first language, recovery-friendly language, or busting myths. But as a recovery ally, there are other things you can do to foster a recovery-friendly workplace community and be a personal ally to people in recovery. So I know we kind of asked this earlier, and I said we'd keep going back to it. How might you be an ally to people in recovery with the knowledge that you have now? Again, feel free to come off mute or enter into chat. listen non-judgmentally. Yes. Yes, provide that non-judgmental, safe space. Person first language, reduce the stigma. Yeah. Be empathetic, not sympathetic. There's amazing video on what empathy versus sympathy looks like. But absolutely being empathetic. Learn more about pathways of recovery. Yes, and recognize that there are so many different pathways to recovery and that it is personalized, as we've discussed. Yeah. So when we're talking about recovery allies, recognize that this is somebody who is supporting individuals in recovery and helps create a recovery-friendly environment. Yeah, I see a couple more came in. Make sure non-alcoholic options are available wherever you go. Absolutely. If you're spending time with someone outside of work, which can be hard to do in Wisconsin. I get it. Yeah, and then just be present and hold space for others instead of trying to fix them. Yeah, you guys are at the University of Wisconsin, right? Yeah, and I feel like I had heard somewhere that there is a like a distillery on campus. Is that correct? Am I thinking of the right space? Nope. Okay. Thank you. Yeah. But yes, I can understand too that sometimes it's hard to find a non-alcoholic option. Okay, so recovery allies support, really support behavior change, right? Decrease desirability, avoid phrases like, I need a drink, do not hold meetings in bars. We talked about several of these. Practice empathy rather than sympathy. Think about difficult behavior change you have had to go through to tap into that empathy piece. Provide feedback, encourage people in their recovery progress. Provide choice, suggest new coping strategies like art or exercise. Clarify goals. Talk with the person about what recovery means to them, why they choose to be in recovery. That'll help with identifying like that pathway that we talked about and how individualized it is. A recovery-friendly workplace and community is an environment where someone in or seeking recovery feels accepted by their coworkers. They're empowered to live genuinely and they feel comfortable asking for help and are celebrated. Strive to foster that non-judgmental community that has empathy and understanding, encourage harm reduction strategies to lessen the negative consequences of risky behaviors. You might, I say harm reduction, right? You might think of like seatbelts or condoms or using like a designated driver. Those are all harm reduction. Make sure that assistance is accessible and culturally competent so that someone seeking help can be easily directed to the right resources. Practice recovery-informed prevention. Introduce the idea of recovery in a non-judgmental way during prevention and early intervention. And understand treatment options. This can include counseling or medication delivered by a licensed professional. And then finally, advocate for recovery support, including peer support, mutual aid group meetings, and so many more. As an ally, here are a few simple things you can do today to create a more recovery-friendly community. You can start by listening or learning more about recovery-friendly workplaces at Recovery Friendly Missouri. So that's just recoveryfriendlymo.com. Add something about recovery to your email signature. Something like recovery is possible or I support people in recovery. I have this little symbol down here on the bottom of my email signature. You might consider something like that, right? Post on social media about something you learned in this training. Help raise awareness for others. September is National Recovery Month. So you can explore this further at recoverymonth.gov. You can also familiarize yourself with local resources for recovery. And additionally, you can print the image here, as I described, and post it in your office, on your door, or wherever you feel would be helpful. One of the last things I want to share is that if you are not a mental health professional, there may be times when someone struggling with substance use or recovery may need assistance beyond what you can provide. In those situations, you can still provide support by sharing resources that the person may want to access, walking with them to a behavioral or mental health service, or providing help as soon as possible, as the window for opportunity may be limited. And again, it's important to be aware of community and online resources for those in recovery. Here you will find a few key resources for those impacted by substance use disorder. But I'm curious, what are some that you guys are familiar with in your area? Again, feel free to unmute yourself or put it in chat. It's always nice to hear the different resources that are available locally. Safercommunity.net, recovery coaching. Fantastic.
It's Art Community Services for Women.
Community services for women?
Yes, Art Community Services.
Art.
They provide ARC, A-R-C.
Oh, okay.
And they provide resources for women. If you even identify as a woman, they'll provide services for you.
Fantastic. Sounds very inclusive. artcomserve.com. Thank you. Excuse me. Yeah, it looks like you guys have several right there at your fingertips for local options. Amare Peer Recovery Support Services. And NAAA, Celebrate Recovery. Yes. Thank you again for your interest in becoming a recovery ally and inviting me here today to share with you. The efforts you make to support those in recovery truly create a rippling effect throughout families, workplaces, communities, and the state. If you would like to revisit this content, check out Recovery Friendly Workplaces in Missouri at recoveryfriendlymo.com. If you want to access the online version of this, you can definitely connect with me later and we can discuss that further. Going forward, I would like to challenge you to be mindful of how you interact with others, whether you know that they're in recovery or not. I hope that this training has been informative and has increased your awareness and understanding of substance use disorders and recovery. And then I have a few citations here, and again, that acknowledgement that this training was really created in collaboration with Partners in Prevention and Recovery Friendly Workplace Missouri. And then I'll hand this back over to Amanda.
Michelle, I'm going to open it up to questions first. Anyone have any specific questions for Michelle before we go through some closing items? Please feel free to unmute or pop your questions in the chat.
So will this be presented again in some type of form or fashion so that we can invite other people to attend?
Sure. So we are recording. The recording and the slides will be made available through Great Lakes ROTA-RC website so that you can share that or point people to that today's information, and they can watch the content after. So we do welcome and invite you to do that. As to whether we will present again, we'll have to follow up with Michelle to see if she would like to do that. Glad you liked it. We're always happy to hear that people enjoyed the session and want to see more of it. Any other questions for Michelle? Michelle, I know I had one. Can you speak to, when we talk about advocate and amplify, can you speak a little bit to talking, advocating on behalf of someone in recovery and consent?
Absolutely. So we can dive a lot into that. I would say when you're advocating for somebody in recovery, again, remember that they may have disclosed that they are in recovery to others, but they may not have, and that absolutely needs to be something that you take into consideration because you wouldn't want to share something that they're not comfortable with sharing. And then also recognize that depending on where they're at in that stages of change, so that going back to that trans-theoretical model, right? They might be in pre-contemplation or in contemplation. And so when we're talking about consent and receiving recovery, it's really important to meet them where they're at, right? And recognize that giving them the autonomy is to make those choices is very valuable in helping ensure that they will stay in recovery for longer and continuing on that journey at their pace. Does that help answer your question?
Yeah, so really making sure that we're not sharing someone else's experience without consent, and really making sure that when someone else is sharing their experience, we're supporting that they're doing that, supporting them, and making sure that we're advocating, understanding our power in doing that as allies and advocating in the right spaces.
Absolutely, exactly.
Brilliant. Thanks. All right, well, let's chat for a few minutes here. If you've attended a ROTA-RC event before, you know that we have a few quick questions. We want to make sure that we continue to stay in contact with you so that you can continue to get updates on events, resources, and regional happenings throughout the Great Lakes. Then you don't have to worry about missing out on great events just like this. The second reason is that we want to also make sure that you get an opportunity to tell us how you found this event. We want to learn a little bit more about you so that we can share with our funder, SAMHSA, how things are going, how we're outreaching. Great Lakes is a great big region, and we want to make sure that we're communicating with SAMHSA that we're getting to as many of you as possible. And we want to find out what's important to you. What do you need professionally as far as training? Because there's a lot of resources out there, and there's a good chance that there's somebody in our network that can provide the things that you need. So we want to make sure that we're doing a good job of getting that to you in a timely fashion. So if you could, I popped into the chat the Great Lakes ROTA extension email. If you could please drop your contact, your full name, your email address into there if you didn't register, and that's perfectly okay. If you got the link and you joined us today through that route, we want to make sure that we're getting you signed up for our contact. The next thing is we want to get you into doing our evaluation. If you could just move it forward a slide there for me, Michelle. We will have you fill out this evaluation. The link is popped into the chat as well, or you can do the QR code with your phone, whichever you're happier to do. That evaluation link, again, just tells us a little bit about who we're doing outreach to, ask you a couple of questions about how you found the event today. It's not that long, I promise you. We just try and make it simple and easy for you, and it gives us a little bit of feedback. And then lastly, we want to just tell you about some events that we have coming up, and that is actually not the most up to date. So, and that's my fault, not Michelle's. So I'm going to send you, I'm going to pop into, there we go. here's our events link. What we have coming up is Indigenous Evaluation, Learning Together, Thursday, May 11th, from 12 to 1 Central Standard Time, 1 to 2 Eastern Standard Time. And medication. So the second one, the Moad harm reduction, coming up, and that will be Thursday, May 25th, same time, 12 to 1 Central Standard Time, 1 to 2 Eastern Standard Time. So those are 2 trainings we have coming up in May. We also have a bunch of trainings coming up in the region in June. So make sure you check out the event regional site page. We've got a lot happening this summer and we don't want you to miss it. Thank you all again for joining us. We're going to go ahead and stop the recording.